could be singing that you...
This is what I really want you to hear. Yeah. Yes. Hello, I'm Cheryl Varden and I am the outgoing chair of the North West Hospital and Health Services Board in Queensland. The Chief Executive is a community leader, and not just a community leader in Mount Isa where the job's based, but a community leader across the whole of the HHS, across the whole of the region. And that's absolutely key, because that means that you have to have a relationship with the police, with other health services, with allied health services, with aged care, with education, with child safety. You have to be really part of that mosaic of services, NGOs as well, that operate to provide health and well-being and the best services to our folk in northwest Queensland. What makes this job different from perhaps other chief executive roles looks on the surface to be a really small job, but that overlooks the complexity of the role. You have to juggle making sure that safety and quality of our patients is looked after, that patient care is paramount, that we have staff, because it's really hard sometimes to attract staff to remote areas. Safety and quality, making sure that infrastructure is kept up with, that maintenance is done, and that Northwest is not neglected. So it's a different job in many, many ways. You've got your fingers hands on lots of things that other chief executives perhaps don't have. Well, I think I've touched on the qualities that leaders need to do well in this job. Community connections, absolutely key. Having courage and imagination, risk-taking, all of those good things, and the solid competencies that sit behind that. Not being afraid is key. But you know what? I think the most important quality that's got us as a board and the HHS through the last 4 years has been a shared sense of humour. The relationship with the board, between the board chair and the board members and the chief executive and the executive leadership team of the HHS is critically important. And it's not the traditional board chief executive organisation relationship that you would expect. It's one where there has to be a real closeness, an absolute sharing of information, beyond no surprises, but really working and planning together. And communication is the key, because board members will want to go with you and be out in that community with you. So once you're out in the community, it's not simply the hospital staff, it's the local mayor, it is community leaders, particularly our First Nations leaders in their discrete communities. It could be the Royal Flying Doctor Service, it could be Life Flight. All of the agencies with which we work are really key to keep in touch with once you're out in communities. The team that the Chief Executive chooses is absolutely critical, and we've had some wonderful people. People who come for a short time and want to move on, people who live in the community and stay, it's a mixture. So key in that, first of all, our First Nations leader, and she sits on our executive team. And we also have our nursing leader, our medical leader, human resources, all of the things that make up a health service. And that team is absolutely key. Keeping that stability, keeping that sense of loyalty to Northwest is very much part of the role of the Chief Executive. Look, I'm an optimistic person and I always have confidence in the future. In terms of what I hope for the future, first of all, I hope that the building work, the legacy that this board leaves behind is maintained. We have a strong sense of how our money is being spent, and that's really critical in health. We have a strong sense of government priorities, which is really important. And we have that top, I guess, strength of safety and quality for our patients. Wherever they come from, whatever their needs are, we're here to help them and to serve them and to to make them better. I think if you have that sense of wanting to serve a community, if you have that strong commitment to health services, and that's really important, a very strong commitment to health services and in their entire range, then you would want this job. If you like the sense of working remotely, that's important. But I have to say, please don't take it if you're looking for a romantic outback holiday, because it's not that kind of job. It's a job where you need resilience and you need to step up, sign up and stay the course. And that's important. You have to have that sense of longevity in the job so that you maintain community trust, which is absolutely critical.